Dr. Roberts, thank you very much for joining us here on Health Connection. Our topic is the prostate, when bigger is not better. It's a topic of great interest to men, particularly as we age. So let's get into it. Benign prostatic hyperplasia, BPH. It's a long name for a prostate that's getting bigger. An enlarged prostate causes problems for men. Explain what the prostate does, why do we have one, and how it works.
So the prostate's function physiologically is in reproduction. Once a man is past reproductive years or he no longer desires children, the prostate per se doesn't have any specific physiologic function, but it gets in the way because the urinary tract and the genital tract are conjoined at the level of the prostate. So it affects urination because of a man's plumbing. But once he's done having children, it doesn't have a specific function for him.
So if a man has an enlarged prostate, which becomes more likely as he ages, what are the most common symptoms to alert him to that fact?
So typically a man, if he has symptoms of BPH or prostate enlargement, he'll complain of urinary difficulty. And we group those symptoms either into obstructive symptoms like slowing of the urinary stream or stopping and starting, or irritative symptoms, symptoms more related to frequency or irritation of the urinary tract, getting up at night, slowing of the urinary stream, really a sensation of incomplete emptying.
Okay, that may segue into our next question. Waking up in the middle of the night to go to the bathroom, having to pull over frequently for bathroom breaks if you're on a road trip. Those are the things we know about. What are some other symptoms for an enlarged prostate?
Well, it may be that a man strains to urinate. Normally, the emptying your bladder shouldn't be volitional. It should happen as a reflex. So if a man's straining to urinate, that can be a symptom of urinary obstruction. If he's stopping and starting, certainly at its end stage, urinary retention where he can't urinate, bleeding, infections, things like that, or later stages or later symptoms of BPH.
Statistics show that it's mostly men over 50 who have problems with an enlarged prostate, but not always. If a man under 50 is having this issue, why is it occurring?
Well, in younger men, it's less common. It doesn't mean that it doesn't happen, but it's certainly not something you would think of initially. A lot of medicine is statistics and what's likely to happen, and we talk about things like differential diagnoses. In younger men, we would almost always think of something like a stricture or scar tissue from prior infection or surgery or trauma. Rarely systemic diseases like diabetes, which can affect how the bladder works, or other causes other than BPH. It can certainly happen in younger men. It's just less common, and you would think of other things that obstruct the urinary tract.
Let's talk about diet. Can a large prostate be caused by poor dietary choices or consumption of alcohol?
I don't think it would be prostate enlargement would be caused by diet or poor choices. I think it can be exacerbated by that. We know that diet and exercise and lack of smoking affects our general health. I think it certainly affects your urinary health. I would think of it more as exacerbating a problem rather than causing it.
Okay. When can an enlarged prostate be a sign of something much more serious? What type of serious health issues would that include?
Well, certainly as a urologist, we're concerned about prostate cancer, which is the most common cancer in men over the age of 50. It has a significant amount of morbidity and mortality. And so we would want to separate benign enlargement versus potentially cancerous enlargement or cancerous obstruction of the urinary tract. That would be the most significant. We would think about bladder pathology and bladder stones, bladder cancer, and then always systemic diseases that can manifest as urologic problems, like problems urinating, really coming from non-urologic diseases. But I think the big ones would be bladder and prostate cancer as our biggest concern as urologists.
Treatment options for an enlarged prostate. What are the most common, most effective treatments?
So the AUA, my professional society, the American Urologic Association, has done a wonderful job with guidelines about treatment for common urologic diseases like BPH. And those guidelines spell out a construct of treatment that goes from conservative to aggressive. And so if I were to group those kind of generally, you can do behavioral or dietary things. You can use medications that work on the prostate, either to relax it or shrink it. And if that's not successful, then you would progress down this treatment pathway towards even procedures or surgery, depending on the severity of the BPH symptoms or associated problems.
Well, let's go one step up from the dietary and behavioral and go to medication that you just mentioned. What's available, how does it work, and how effective are the medications?
So really, medical therapy for prostate enlargement has been around for decades. It's become more specific to the prostate, but the first general class of medications actually relax the prostate's grip on the urinary channel so that urine can flow less impeded and unobstructed. And alpha blockers are medications that relax the prostate. Another class of medications for prostate enlargement are for men with an overly enlarged prostate, and over time they will actually shrink the prostate so that the urinary channel is less obstructed. And those are the two main classes of medical therapy for prostate enlargement.
Let's take the next step, surgical options. What are some examples? How do they work, and are they a permanent solution?
So if medical therapy isn't successful or is not satisfactory, the next step would be a procedure or surgery for prostate enlargement. And those, again, vary on their invasiveness. The procedures all involve some form of energy to open up the urinary channel and relieve the obstruction. The goal of minimally invasive treatments are to cut down the risk of standard surgery, but again, alleviate that obstruction. Those energy forms are either heat, microwaves, stitches or sutures, cooling, but different forms of energy to unobstruct the urinary tract. Standard surgery is a procedure where we resect or physically remove part of the obstructing prostate. And those treatments vary on a patient's wishes and a side effect profile.
One of the newest treatment interventions for an enlarged prostate involves steam. Is this a proven procedure, and how does it work?
So steam is a form of energy, and when steam injected into the prostate becomes liquid, it releases that heat energy. So it's a form of heat treatment to relieve the obstructing prostate. It was FDA approved in the year 2015 under a proprietary name, and it is effective. The studies that we have to date are intermediate term, and they show relief of obstructive symptoms.
Okay. What advice do you have for a man watching this segment who's having symptoms of an enlarged prostate?
Well, I think it goes to starting with your doctor and discussing with him the severity of your symptoms to make sure that it's not something more serious, and then discuss those treatment options that go from conservative to aggressive, focusing on relief of symptoms and lifestyle relief. There's a vast array of treatments, and I think that it's a problem that tends to slowly develop. And so checkup can kind of alert a man to how much this is bothering him or how much can be done to help him with his quality of life.
As a man ages, does an enlarged prostate become inevitable? Is it going to happen?
Well, I think statistically it's very common as we go through our 50s, 60s, 70s, and beyond. I wouldn't say it's inevitable. I think every decade we get older, it becomes more common. Not inevitable, but quite likely.
All right, very well. Doctor, learned a lot. Thank you.
Thank you.